Imagine waking up one morning and looking at your reflection only to find a stranger staring back. Small, forgetful moments start to pile up. Misplaced keys, repeated questions, forgotten appointments. At first, it seems like harmless absent-mindedness, but then the gaps grow wider. You lose track of time, find yourself disoriented on familiar streets, and struggle to recall treasured moments with loved ones. Dementia isn't simple forgetfulness. It strikes at the heart of your identity, unraveling the memories, skills, and connections that define who you are. Many people assume cognitive decline comes solely from aging, but recent research points to a more disturbing culprit. Everyday medications prescribed to millions of people may be quietly accelerating this devastating process. Worldwide, more than 55 million people suffer from dementia, and experts estimate this number will triple by 2050. In the United States alone, over 6.7 million individuals currently live with Alzheimer's disease, the most prevalent form of dementia, with projections doubling that figure within the next quarter century. What's alarming is that many of the drugs fueling these numbers are not rare or experimental. They're staples in medicine cabinets across the globe. An influential 2023 study published in JAMA Neurology revealed that certain widely used medications can raise dementia risk by up to 79%, from antihistamines and heartburn treatments to anti-anxiety pills and blood pressure drugs. These prescriptions are reshaping brain health statistics and shortening lives without many patients or doctors fully realizing the stakes. Consider the antihistamines you reach for when allergies strike or insomnia haunts your nights. Diphenhydramine, better known by brand names like Benadryl or Unisom, blocks acetylcholine, a neurotransmitter critical for memory and learning. Deprived of this chemical, neurons shrink and neural circuits weaken. A landmark 2015 study in JAMA Internal Medicine linked 3 years of heavy antihistamine use to a 54% increase in dementia risk. Even short-term use clouds the mind with fog, leaving users dazed and unfocused. Seniors pay the highest price. Their natural acetylcholine levels already ebb with age, so each dose of an anticholinergic sends them closer to cognitive collapse. Next come benzodiazepines, or benzos, a class that includes Valium, Xanax, and Ativan. Originally hailed as breakthroughs for anxiety and insomnia, these drugs slow brain activity by enhancing a calming neurotransmitter called GABA. The effect is immediate relaxation, but the cost accumulates over months. A 2022 British Medical Journal study reported that individuals over 65 who took benzos for just 3 months faced a 32% higher risk of cognitive decline. Long-term users exhibited an 80% increased risk of developing Alzheimer's. Beyond eroding memory, benzos contribute to confusion, falls, and hospitalizations among seniors, yet they remain one of the most commonly prescribed sedatives in geriatric care. Proton pump inhibitors, or PPIs, designed to ease heartburn, have likewise been implicated. Drugs like Nexium, Prilosec, and Prevacid reduce stomach acid, but by doing so, they hinder absorption of vitamin B12, a nutrient essential for nerve health and cognitive function. A 2021 study found that adults over 60 who used PPIs for more than 4.5 years saw a 44% surge in dementia risk. Chronic acid suppression also disrupts gut bacteria, leading to inflammation that further damages brain tissue. What many users fail to understand is that PPIs were intended for short-term relief, yet countless individuals rely on them for years, often unaware of the potential brain-injuring side effects. Antipsychotics, once reserved for schizophrenia and bipolar disorder, now often serve as chemical restraints in nursing homes. Medications such as Risperdal, Seroquel, and Zyprexa block dopamine, a neurotransmitter vital for learning and decision-making. A 2023 Lancet Psychiatry review confirmed that prolonged antipsychotic use causes measurable brain volume reduction, especially in areas governing memory. While these drugs can quell severe agitation, they do so at the expense of cognitive vitality, effectively accelerating the very decline they are sometimes meant to manage. Statins, celebrated for their cholesterol-lowering prowess, have also been called into question. Names like Lipitor, Crestor and Zocor are household staples for heart health. Yet a 2020 study reported that seniors on high-dose statins faced a 58% greater likelihood of developing memory impairment. Statins deplete coenzyme Q10, a molecule cells need to generate energy. Neurons, starved of this power source, falter, leading to the so-called statin brain of mental cloudiness and forgetfulness. Furthermore, cholesterol is not merely a vascular villain. Neurons require it to build membranes and synapses. Depleting cholesterol too aggressively may disrupt neural communication at its most fundamental level. Antidepressants bring another layer of complexity. Selective serotonin reuptake inhibitors, SSIs, like Prozac, Zoloft, and Celexa, along with tricyclics like Elavil, increase serotonin but may curb neurogenesis, the birth of new brain cells in key memory regions. A 2019 neurology study linked long-term antidepressant use in older patients to elevated dementia risk. Ironically, drugs once prescribed to ease depression may, over years of use, contribute to cognitive frailty, underscoring the need for nuanced, individualized treatment strategies. Beta blockers, prescribed to tame high blood pressure, slow the heart, and reduce cerebral blood flow. A 2022 Journal of the American Heart Association analysis found that chronic use correlated with a 35% increased dementia risk. By cutting the brain's oxygen and nutrient supply, these medications leave neurons gasping, accelerating shrinkage in memory-critical regions. They also block norepinephrine, a neurotransmitter that sharpens alertness and learning. Patients frequently report beta blocker brain, a haze of diminished focus and energy that compounds as years pass. Opioids prescribed for moderate to severe pain relief wield their own neurotoxic legacy. Oxycodone, morphine, and fentanyl dampen pain receptors, but also disrupt opioid systems integral to neuroplasticity, the brain's ability to form new connections. A 2023 neurology report revealed that older adults on long-term opioids experienced a 40% faster rate of cognitive decline. Chronic use can erode white matter, the brain's information superhighway, causing mental slowing, decision-making struggles, and memory lapses. In the midst of an opioid crisis, these findings demand urgent re-evaluation of risk-benefit calculations, especially for the elderly. Muscle relaxants like Flexeril and Soma, often prescribed for back pain, sedate the central nervous system. A 2020 Journal of the American Geriatric Society study linked regular use in older adults to a 36% higher dementia risk. By depressing neural circuits, these drugs slow thinking and impair memory consolidation. Coupled with increased fall risk, muscle relaxants introduce a double-edged threat to seniors already contending with age-related cognitive shifts. Sleep medications round out the top 10. Ambien, Lunesta, and Sonata, which many rely on for nightly rest, suppress deep sleep stages essential for memory consolidation and brain detoxification. A 2019 British Medical Journal study found that seniors using sleep aids twice weekly faced a significantly greater dementia risk than non-users. Altered sleep architecture can spark lasting brain atrophy, heightening confusion and vulnerability long after treatment stops. Anticholinergics, a broad class including drugs for bladder control, motion sickness, and Parkinson's, directly block acetylcholine. A definitive 2018 BMJ study showed that as little as 3 months of anticholinergic use boosted dementia risk, with a 49% increase for those on long-term regimens. With aging brains already low on acetylcholine, further blockade accelerates neuronal death, making anticholinergics a major global contributor to medication-related cognitive decline. Finally, corticosteroids like prednisone and dexamethasone mimic the body's stress hormone, cortisol. While powerful anti-inflammatories, these drugs damage the hippocampus, the brain's memory center. A 2022 neurology paper documented a 66% higher risk of cognitive impairment in regular users. Steroid-induced shrinkage and confusion can escalate to a reversible steroid dementia, though in many cases damage persists even after cessation. Dementia is not merely fading memories, it is a catastrophic failure of the entire brain-body network. As neural circuits crumble, vital functions like swallowing weaken, leading to aspiration pneumonia, the leading cause of death. Malnutrition and dehydration follow as swallowing reflexes falter. Immobility breeds bedsores, infections, and sepsis. In late stages, the brain loses control over breathing, heartbeat, and digestion. Most patients die from these complications. Mortality rates within 5 years exceed those of many cancers. If you or a loved one rely on any of these medications, do not panic, but do not ignore the risks. Engage your healthcare provider in an open dialogue about alternatives, lower doses, or non-pharmacological options. Diet, exercise, cognitive training, stress reduction, and social engagement can offset medication-related risks and bolster brain resilience. Anti-inflammatory diets rich in omega-3 fatty acids, antioxidants, and B vitamins support neuronal health. Regular aerobic exercise enhances blood flow and neurogenesis. Mind-challenging activities, learning languages, playing instruments, or solving puzzles stimulate synaptic growth. Medication can save lives, but every prescription carries potential side effects. Awareness empowers you to make informed decisions, balancing benefits against long-term cognitive costs. By proactively managing drug regimens, adopting brain-healthy lifestyles, and prioritizing early detection of cognitive changes, you stand the best chance of preserving your identity and independence well into your golden years. Our brains are not doomed by age alone. They deserve vigilant care against all threats, including the hidden dangers in the medicine cabinet. Take charge now before those priceless memories slip away.